Knock knock. Hi, how are you doing? I'm Nurse Lucy, it's very nice to meet you. I will be your nurse today. Okay, so how are you feeling? I know, you've only just come out of surgery. Yesterday. Yeah, you were seen by Dr. Lucy. Oh no, too many Lucys. Amazing, how are you feeling? Okay, so I'm going to be changing your wound. Changing the dressings to your wound. I will be your nurse the whole of the day, so anything you need, you just call me. Okay, so just check your, sorry, where did I put my pen? Give me 2 seconds. These pens are like gold dust here. You turn around and they're gone. Okay, so we've already had our ops done. Pulse looks fine. We didn't take your temperature, so I'll do that for you now. Can you just confirm your date of birth for me? Nice, okay. How is your heart feeling? Yeah, it can get a little bit of getting used to when you get a new heart. Yeah, okay. So, first things first. Just going to take your temperature quickly. Okay, so let's get started. I'm just going to pre-warn you that it may sting just slightly. You have just had surgery, so everything may be feeling a little bit sensitive. Another question I have for you, sorry. How's your pain? Let's do it from a scale, so from 1 to 10. A 6. Okay, so bearable, painful but bearable. Okay, did you last have pain medication? Okay, so you're due some very, very soon. So I will give that to you as well before I leave. Okay, so it's going to be your first dressing changing, so I would look away if you're not a fan of blood, because there may be some blood spots in your dressing just there. Can you just pull your collar away from me? Okay. I thought I had some gloves somewhere. So how are you feeling? Are you feeling sleepy, or you look quite tired? Dr. Lucy, yeah, Dr. Lucy is great at her job. She's our leading heart surgeon. She's very lovely as well. Okay, so I'm just going to quickly just prepare myself. Just give me 1 moment. Okay. So if you just pull your collar, I'm really quickly going to take this bandage off, okay? There we go. Okay. So all I'm doing is I'm just dabbing around the wound, okay? Not that much. Okay. So this might sting just a little. So I'm just going to go around the room. I'm not going to go onto where your stitches are. I'm just going to go around, okay? You're doing good. Dr. Lucy said you're prone to fainting. Hopefully not anymore. Okay. So this is just a cream that we put on the wound. It's just going to go around the room. I'm just going to, this is why I've got gloves on. I'm just going to go around the room with my finger. So Dr. Lucy told me that you should be able to go home very, very, very soon. She would like to come and check on you herself before you are discharged. So she'll be around later today. Okay, right, you ready? Good. Just got a bit of a bigger one. Just bear with me one moment. Yeah, I know. Good. Okay. Right, so now I've cleaned it, I'm just gonna apply this back on, okay? You ready? Okay, and later I'll be around to change it as well. I'm here till 8, so you have me till then. Are you going to try and eat something today? I know you may not feel that hungry, and our food is... I get it, don't worry. But I really do need to try and eat something. Okay, so we'll try later, okay? Okay. Let me just check your temperature one more time. So, temperature is 30. You do have a slight temperature. It's not too over, so I'm not too concerned. Okay, now it's time for me to have a listen. I'll let you listen too. Sorry, actually, let me just take my gloves off. Okay, don't worry about breathing. I'm just listening to your heart, okay? Okay, now I want you to take a deep breath in. Hold it. And breathe out. Deep breath in. Hold it. And breathe out. Nice. Oh, sorry. Yeah, of course. You wanted to have a listen. Okay, I'm just gonna put this just Ready? That is your new heart. Yeah. Good job. Sorry, let me take these off of here. Okay, so we are done. I know that Dr. Lucy wants to come and speak to you as well, so you will be seeing her a bit later. But yeah, if you need anything, please let me know. Just you have a call button just there, and I'll be over to check on you and do your observations anyway. And we will try and eat something later. Okay. Okay. Well, it's very nice to see you. Thank you. I will see you a bit later. Okay. Okay. Bye. Knock knock. Hi, how are you feeling? Okay, how's your pain? Wonderful, okay. I haven't actually had the chance to talk to you about your op. So your op went fantastic. It was, like I said before, very, very easy process for us to do. So yeah, I'm just going to come in here and listen to your heart as we did last time, and I'm just going to take your blood pressure as well and just do a couple of exams myself. Okay, good. Well, you're smiling, so that's always a very, very good sign. Okay, I don't know why I've taken this off and put this back on. Oh, it's been one of those days today. I've had about 17 coffees. Okay, as before, can I have this hand? Perfect. Pop that on there. And again, I'm going to be looking down just here. Ready? Sorry. Try that again. Very nice. Okay, so let's have a listen to your new heart. As usual, don't just breathe as normal. Very nice. Okay. Now I don't want you to move that mat position. You need to be laid down for the next few days. I know, I'm going to keep you in here, but I'm going to come keep checking on you. Obviously you got Nurse Lucy. I know, Dr. Lucy, Nurse Lucy. Very confusing. She's good though. I'm going to check your wound. Yeah. Okay. I'm just going to peel it back just a little bit. She did a very good job at cleaning this. Good. Good, good. I'm happy with that. Okay. Let me just check your ECG was fine also. I know that Nurse Lucy came and took that a while ago. But I'm very, very happy with your progress. How is your pain? On a scale of 1 to 10. Okay. Nurse Lucy mentioned something about you're not eating. Is it because you don't like our food? It's okay if you don't. Okay, you just don't feel hungry. Okay. So we're gonna need you to try and eat something. I know you're probably still feeling quite groggy, but we need you, even if it's just a bite of a sandwich. Because otherwise we'll need to be having a look at feeding you through an IV. So, and obviously we don't want to do that. So yeah, try your best to try and eat something, okay, today. And I'll come and check on you tomorrow as well. Okay, how does that sound? Okay, well, Nurse Lucy needs to come and do your op. She is looking at me very sternly. I need to leave, but I will see you tomorrow, okay? Please make sure you're resting as much as you are, like as much as you can, okay? Yeah, and you need to make sure that you're not touching that area here, okay? Okay. I'll see you tomorrow.